Hi, I'm Dr. Rahman, and I'm going to talk about a very common GYN complaint, the yeast infection. The yeast infection, the medical term is candidiasis vulvovaginitis, which means that there's irritation and inflammation of the vagina and the vulva, which is the skin outside the vagina, in the perineal area. When a woman has a yeast infection, she will often complain of having a cottage cheese-like discharge with associated itching and irritation of the outside skin. These symptoms are usually so severe that she has to see the gynecologist or someone for adequate treatment. Treatment can be obtained from over-the-counter medications, or more commonly, there is a prescription that can be given to women for this condition. Now, there are some women who are predisposed to yeast infections. These are women who have medical conditions such as diabetes predisposes you to a yeast infection. Being pregnant predisposes you to a yeast infection, and being immunocompromised or taking medication which can compromise your immune system predisposes you to a yeast infection. As always, I tell women the first place that you need to turn when you're trying to resolve the problem of a yeast infection is to look at your diet. You need to avoid sugar and ultra-processed foods. Easy to say, sometimes not so easy to do, but it's the first place to look, the first thing that you can do if you feel as though you have a problem with recurrent yeast infections. Too often, women mistake other vaginal infections for yeast infections, and they may be taking medication for one thing, thinking it's a yeast infection, only to find out that it's not a yeast infection, which is why it never goes away. So I say, if you have a problem with recurrent yeast, first confirm with your gynecologist or your nurse practitioner or your primary care doctors, but first confirm that it is in fact yeast and that it's being adequately treated. The yeast infection is the second most common vaginal infection, second only to what's called BV, bacterial vaginosis. And in the next video, I will talk a little about bacterial vaginosis. If you have any questions for me, please send me your questions. Tell me what you would like me to talk more about. I want to explain as clearly as possible. The better you understand, the better you can take care of your health, and your health is priceless. Again, this is Dr. Rahman. Take care.